My name's Herk.
Andrew Campagna.
I'm a registered nurse and I work with an organization called Ottawa Inner City Health.
I work for Ottawa Inner City Health as a registered practical nurse.
We're based in Ottawa and we provide healthcare to the homeless, and I work as a team lead for our mental health nurses.
What is your best advice or key messages for nurses working in the community?
Being kind. Being kind to the clients you're working with, and being kind to yourself.
Really listen to everybody, be that helpful ear.
We've never experienced a pandemic before. Our clients have never experienced a pandemic before. And so when I think about I work with the homeless and work with very mentally ill clients, and people react to stress differently. And
validate any problems that they have, offer solutions. Sometimes it's just best just to be that listening ear.
But I also think about being kind to ourselves, because as nurses, we're working in extremely stressful situations and we're being asked, to be heroes. We need to find some time to be kind to ourselves. And so giving ourselves the time and the space to be able to express the challenging emotions we're having. I know for us during COVID, we were really afraid of our clients dying. Our clients are very marginalized. There was significant fear. And so finding the space to come together as a team to talk about that was really important during COVID.
How has COVID-19 changed your nursing practice and or setting?
I went from working in a supervised consumption site to we turned a community center into an isolation unit.
For the homeless, so to help isolate any possible COVID positive people from the rest of the shelter to try and prevent an outbreak.
So it was a ton of work the first few weeks of learning the new environment, figuring out the little details, and really just creating new directives and just everything to make sure that it flows properly. A lot of learning as you go.
We had a mental health van that was operating before COVID, and during COVID it got switched from doing mental health care to being a COVID assessment center. And so we were using this van to go to different places in the city with homeless people to assess them for COVID. And so our mental health nurses were no longer doing mental health care solely, but also providing COVID care. So they were swabbing people, assessing people for signs and symptoms of COVID. The one thing, as much as I say they were doing COVID care, mental health care was still very much a part of that, because COVID has been extremely stressful and anxiety provoking. And the experience of going into isolation and being moved from the shelter where you normally stay into a different place has also been really stressful for people, and at times really brought up past traumatic experiences. So for our Inuit clients who have experienced, having to go into a tuberculosis hospital, that experience of being moved and being separated was really difficult. And so having to use your skills as a mental health nurse to being trauma informed and talking with people about what they could expect, the kind of care they were going to receive, was all really, really helpful in making people feel comfortable to get the care that they needed.
Tell us about one positive experience you have had in your practice during this pandemic.
The positive experience I've seen during COVID has been how our nursing team has come together. At first, we were not coming together because partly social distancing, partly because we were just working so hard. And then a couple of weeks in, we said, we need to get back together and do our weekly team meetings. That is something that is a regular practice in our setting. And it was really refreshing, to come together as nurses and talk about some of the difficult situations we've encountered, get our different perspectives together. It was also really positive to come together and laugh, and we have a very dark sense of humor, and the dark sense of humor is what's helps us to get through the tragedy and the trauma that we experience as nurses working in the front lines of the opioid crisis. For instance, we've had several overdose deaths during during COVID. And so being able to come together and to talk and to share and to express our distress it has been, I think, honestly, it's what has gotten me through, is knowing that we are doing this together as a team, and that as much as this is very difficult, I also can look around the room at my nursing colleagues and say, these people have my back, and we're going to get through this together. And seeing my coworkers' strength and their compassion and their resilience helps me stay strong and resilient as well.
One of the more positive experiences I've had during this pandemic is in the area I'm working in. I'm able to have more one-on-one time with a lot of the clients I work with. And it's helping me to help them access services that they'd have difficulty time accessing. So housing, whether it's a CMHA worker or looking to get into treatment, or just simply looking to get their medications fixed and be able to meet with mental health nurses. So it's been a lot of great success in helping our population get more and more access to stuff that they normally have hard time getting access to.
Tell us about your lived experience working during COVID-19.
At the beginning, when COVID first came out, one of the first hard things we had to do was empty out one of our units that's in the homeless shelter. That is it's a medical unit for people that are getting discharged from the hospital into the shelter and need things like CCAC care, they need mental health care. So these are people that are really, really sick. And we had to empty that unit out, and we had to tell people to, they would say to us, like, where are we going to go? Where are we going to get care? And we had to say, you have to just go in the general shelter. And it was really difficult because some of these people were people that we had worked with for a long time, had, that were very paranoid, and that we had to really take the time and the energy to get them to trust us, and then to have to say, I'm sorry, but you have to leave, and having to do it quite quickly was really difficult and distressing. So I think the other thing, I work as a team lead for mental health nurses, and the mental health nurses I work with were not doing mental health nursing. They were having to do kind of whatever we needed to get done. So they were helping empty out units. They were helping doing COVID swabbing. They were helping run medical care so that people were still getting care. And so they were using their skills as mental health nurses to help people in this very stressful situation still keep getting care, and acknowledging the mental health needs while, helping somebody get swabbed for COVID. So we really had to just kind of step up and be prepared to do whatever needed to get done in those days of figuring out, training staff on PPE. So it was really like a day by day, not knowing what you were going to have to do that day, not knowing what new information you were going to be getting, and having to kind of stay cool and calm and collected, and a lot of saying I don't know, and having to go find out information, or being wrong and being like, okay, that information was what I was told yesterday, but it's not true today. And that was difficult as a nurse manager, of wanting to lead the team and not always being able to not always have the information right, because it was changing so quickly.
What solutions or strategies have you found helpful in caring for clients in the community?
While working in the isolation unit for COVID-19, we were fully gowned up, masks, visors, gowns, everything, where we normally work in street clothes. So carrying an ID on us, it's visible to a lot of our clients, so that they know that it's a familiar face, a familiar nurse, and that makes them a lot more comfortable when dealing with us, knowing that we understand that they may have like mental health, substance abuse issues, makes caring for them a lot easier, and it makes everything kind of flow a lot better in the